see macrolide antibiotics, particularly azithromycin, clarithromycin, erythromycin. These are the most commonly used macrolides, these three. But the prototype is erythromycin. It was extracted from Streptomyces erythromyces back in 1952, and now we have semi-synthetic derivatives in the form of clarithromycin and azithromycin, which are very, very commonly used all over the world by physicians. First, let us talk about erythromycin. Erythromycin, it has a broad spectrum. It's effective against gram-positive organisms like pneumococci, streptococci, staphylococci, and corynebacterium. And especially when you have enough concentration, it's also effective against mycoplasma, Legionella, Chlamydia trachomatis, Chlamydia psittaceae, so Helicobacter listeria, and also Mycobacterium cancerci and Mycobacterium scrofulaceum are also susceptible. So those are the gram-positive organisms. Coming to gram-negative organisms, Neisseria, Bordetella pertussis, Bordetella henselae, Bordetella quintana. These are the etiological agents of cat scratch disease and bacillary angiomatosis. So those are the main organisms. Also Treponema pallidum, we can say. We can say Haemophilus influenza is somewhat less susceptible to erythromycin. So those are the gram-positive and gram-negative organisms. But unfortunately, resistance is growing against erythromycin. Now, coming to the pharmacokinetics, erythromycin base is destroyed by stomach acid. So that's why we must administer erythromycin by enteric-coated form. But it interferes, the food especially interferes with the absorption. The half-life of erythromycin is only 1.5 hours. And you don't have to adjust the dose for the renal function. And erythromycin is, when we think about clinical uses, let me give you the main clinical uses. It is the drug of choice in corynebacterial infections like diphtheria, corynebacterial sepsis, and also erythrosma. So corynebacterial infections, number one. Number two, chlamydial infections. Whenever you see chlamydial infection, it is a drug of choice. And number three, community-acquired pneumonia, because it has a spectrum against pneumococcus, mycoplasma, and Legionella, the most common causes of community-acquired pneumonia. We use erythromycin against community-acquired pneumonia. Number four is whenever there is penicillin allergy and staphylococcus is there, if it is susceptible, you can use erythromycin, and also streptococci and pneumococci. And emergence of erythromycin resistance, that's the problem. Group A streptococci and pneumococci that causes the problems like pharyngitis, soft tissue infections, skin infections. That's making erythromycin a less desirable choice. That's unfortunately that's due to the resistance that is emerging. The other thing is as prophylaxis in endocarditis before dental procedures. But nowadays we are using clindamycin because clindamycin is better tolerated than erythromycin. That's why erythromycin is largely replaced by clindamycin. The other use is with 1 gram of erythromycin, when you give it in combination with neomycin and kanamycin, it's used in the preparation of colon, before preoperative preparation of colon. So those are the most important uses of erythromycin. And the other use is erythromycin causes increased gastric motility. That's actually side effects, and we can use it. That's why we can use it in gastroparesis, because gastroparesis is slower motility of the GI tract. And so the most commonly encountered problem that makes persuades us to discontinue is gastrointestinal intolerance, because erythromycin, it just disturbs and increases the gastric motility. That's why many times we stop this, but Fortunately, the same side effect will be useful when we treat patients with diabetic gastroparesis. Now, coming to toxicity, the most important point is erythromycin causes liver toxicity. It causes cholestatic hepatitis, resulting in jaundice and increased liver enzymes. Those problems happen whenever we use erythromycin. Also, it increases with the dosage, and when you re-administer the drug, it causes the problem to increase. Now, drug interactions. Erythromycin, it inhibits cytochrome P450 enzymes in the liver. That's why medications like theophylline, anticoagulant, cyclosporin, methylprednisolone, these drugs, they increase in concentration in the serum. And also the other drug is digoxin. Digoxin's concentration increases because erythromycin makes its concentration increase by inhibiting the cytochrome P450 enzymes. That's why you should always make sure that you are following digoxin levels when you put the patient on erythromycin. Now, a few words about clarithromycin. Clarithromycin, virtually identical to erythromycin, and but it is more active against MAC, Mycobacterium avium complex. So clarithromycin, it has good activity against Mycobacterium lepra and Toxoplasma gondii. So clarithromycin, that's why, is desired by so many physicians nowadays. I mean, even more desirable than azithromycin, because it penetrates the tissues so well, and sometimes its concentration exceeds the serum concentration in tissues. It is metabolized in the liver, and a portion of it is also secreted in the urine, and that's why dosage reduction is recommended in renal function. You see, when we talked about erythromycin, you don't have to reduce the dose in renal dysfunction, but when it comes to clarithromycin, you need to keep an eye on the renal function, especially if creatinine clearance is less than 30 ml per liter. You need to decrease the dose of clarithromycin. Now, the most important point is there are three advantages to clarithromycin when compared to erythromycin. Number one, it has lower incidence of gastrointestinal disturbance. You remember, erythromycin causes so much gastrointestinal disturbance, but it causes less. Number two is its low dose, because it has such a long half-life. So you can keep it like low frequent scheduling. Number three is low cost. So lower incidence of GI mortality and lower scheduling and low cost makes it like clarithromycin is made more. More physicians, they like clarithromycin than azithromycin. And azithromycin is a very important medication. Tons and tons of it is prescribed daily by primary care physicians and pulmonologists all over. And it has the good feature about azithromycin is it has such a long half-life. Sometimes it reaches like 3 days. That's why you can just give 500 milligrams on day 1 and give 250 milligrams from day 2 to day 4, and that makes it a very compact schedule. So its long half-life is another good feature about it. Imagine treating chlamydial urethral cervicitis like 7 days of doxycycline, but just one dose of 1 gram of azithromycin is sufficient to treat it. So it has a very, very good feature. It is rapidly absorbed.